Vibration plates are the next big thing. PRP should be used for knee pain. Is this the kind of content you're seeing? Hi, I'm Dr. Vikram Mhaskar, a knee and shoulder surgeon from New Delhi, India. And today I'm going to be speaking to you about, do vibration plates and PRP really help in knee pain? So first, let's understand what are these vibration plates. So these plates are plates that move at a particular frequency. What is frequency? The number of times a structure moves per minute or per second or whatever. So when you apply one of these massagers you get on your body, what do? They keep moving and it gives you some deep muscle relief. So that's how these vibration plates help. What they do is they put it on a particular joint. By the vibration, the muscle is activated, and when this muscle is activated, blood circulation can increase a little bit in that area. And because of the vibration as such, you focus more on the vibration, less on the pain, and it may give you some kind of relief by acting as a counter irritant. However, is it a long-term solution? Absolutely not. These are age-old things like massage, etc. They help. But are they a solution to knee pain? Maybe initially when you're playing mind games with yourself, but definitely not over a long period of time, because they don't have any inherent scientific basis as to how they actually help in the root cause of the pain, which is either cartilage degeneration or a tear or whatever. For that, it requires healing. So healing will require firstly diagnosing the problem and then doing whatever is required to fix that particular structure that is not doing its job. But however, these vibration plates are not harmful. There's no harm using them unless you have some open wounds, etc. Please don't use them there. But if it's giving you some kind of relief, use it. But remember, it's not science, it's more of fiction. Next, coming to PRP. So what is PRP? PRP is basically platelet-rich plasma. So your blood is made up of 3 cells. Cells are little structures that make up blood. One are the red blood cells. They give the color to the blood. They carry the iron. Second is the white blood cells. What are the white blood cells? These are cells that are meant to fight against infections, etc. in your body. Third is platelets. Platelets are the cells that help in clotting. Now, the platelets have anti-inflammatory properties. So in PRP, what is done is the blood, about 10 ml, is taken. It's put into a machine called a centrifuge. A centrifuge is a machine that rotates at about 6,000 to 10,000 revolutions per minute. When this rotates, it separates the platelet area, and that platelet area is concentrated, taken out in a syringe and injected into the knee. They say it works through anti-inflammatory effects, but however, the science backing it is not very strong. The American Orthopedic Association has guidelines and strength of evidence to say whether a particular thing helps or no. And this has very little evidence, is almost 1 star vis-a-vis knee pain, etc. But a lot of these things help by placebo effect. So many times you feel till the time you spend some money, you don't want to get surgery done. When you've been told, you try everything else. And remember, 50% of every problem is in the mind and 50% is in the body. So when you have a problem in the body, the thoughts surrounding it, oh, will I be able to walk? Will I be able to work, etc., make you get worried. And that increases your 50% problem to 100. When you do something, you spend some money, you feel you've done something for yourself. That may at least take off that 50% and you may feel better. But it does not address the root problem. So evidence is lacking. Time will tell. Such interventions work. But as of now, both these, for all practical purposes, not really science, but more of myth. I hope you like my video. If you like my video, please like and subscribe to my channel. Please follow me on Instagram. For those who like Hindi content, we have a very popular silver button Hindi channel. Please like, subscribe and follow it. And if you want to get in touch, please do.